And she is the first Zika-linked baby to be born in the New York metropolitan area after her mother tested positive for the Zika virus. Dr. Manny Alvarez helped deliver this child, and he joins us now. Manny, what happened? She was born yesterday?
She was born yesterday about 3 o'clock in the afternoon. This is a young woman that came from Honduras recently. I think she was visiting extended family. And, she showed up to our center of high-risk pregnancy saying that there was something wrong with the baby's brain. She was not sure because the doctors in Honduras did not give her a definitive diagnosis. What she was able to tell us is that she was bitten by a mosquito early in the pregnancy. She did develop a rash. Her mother's a microbiologist locally there in Honduras, and I was able to, because they didn't have the resources in Honduras to take a test for Zika, so she was able to send the blood over to the CDC, and we did receive confirmation from the CDC that she was indeed positive. So when we did the ultrasound, it became very apparent to us that the baby had the small head microcephaly. It was very growth restricted. It had multiple issues that we were very concerned about. We brought her back yesterday, Tuesday, and our team, of high risk OB, we all decided that it was best suited to have the baby delivered. She was a previous C-section, so we went ahead and did do that.
How's the mother, but what is the prognosis for this child?
Well, the prognosis for the child is highly guarded. I mean, the baby did come out crying, it was moving and all of that, of course. But, this is a baby whose brain is incredibly underdeveloped. And when that occurs, basically it's going to have deficiencies, perhaps motor deficiencies, blindness, it's maybe not going to be able to hear, definitely cognitive dysfunctionality. It might include, seizures and tremors and things of this sort. So this is a baby that's going to have a very challenging upbringing.
People look at this and they feel for the child, the mother. But Manny, what about this country and the risk to people in this country in terms of the potential for this virus to come here as the summer season wears on, and people who are thinking about getting pregnant?
Well, look, in this country, I don't think we have a problem. Yeah, we have isolated cases of Zika, people that have come to the continental U.S. We do have the type of mosquito, especially in the southern states, but we don't have the combination of a lot of people being infected and a lot of mosquitoes at the same time, which would make it for a big spread. However, I think we have to take absolute advice from what the CDC is saying, which is do not go to areas, especially Central America, South America, Caribbean, where this is an endemic problem. If you are pregnant, or if in another particular case, if you have underlying chronic medical diseases, if you are in immunosuppressive therapy, things of the sort which your immune system is compromised, don't go to areas where the Zika is found.
What about if you think you're even thinking of getting pregnant? Because then do you run a risk if you contract the virus and maybe you think it's out of your system and then you get pregnant?
Well, look, there's a window. This virus does not stay with you forever. This is not like HIV or hepatitis. So you're going to get a viral load, a viral infection, then your body's going to react to it, and eventually the virus is going to die off. So this is not you don't become a chronic carrier of Zika once you get infected. So that window is vital for you never to get pregnant. But then once that window has eroded, then you can go ahead and lead a normal life.
But we should be on the lookout potentially for this virus to come here.
Absolutely. If you're pregnant, if you travel, if you think and your significant other has gone to areas where the Zika is present, again, this is something that can be contracted through intercourse.
Right. Manny,
All right?
It was great to see you.
Good
Dr.
to see you.
Manny Alvarez, a pleasure always.
You got it.